Okay, hello everyone. Okay, today we'll start our social level 12 unit 14, right? Part 2 for healthcare in Cambodia. So this part 2 will study about in our view major health problem. So what is the health problem in Cambodia and maternal and child health care. So the care of children and also the mother, right, in there. Okay, so before we start, let's go to our vocabulary first. The first one is malnutrition. It's noun, lack of proper nutrition caused by not having enough to eat. That means undernourishment or malnourishment. That means we don't have enough food to eat, right? Just like vitamin or protein we don't have. So in Khmer, what does it mean? Yeah, very good. Come back, right? We don't have something to eat. In not eating enough, uprising, or being unable to use food that one does it. Okay, example here, nearly 60% of the country population suffer from malnutrition. Right? In the past we have a lot. This is the part we study, right? In part 2 for healthcare in Cambodia. So another word is tuberculosis, an infectious bacterial disease characterized by the growth of noodle, tubercle in tissue, especially the lung. We can say when you have the catch or cold for more than 21 days, so it is tuberculosis. What does it mean, man? Yeah, very good to obey, right? We can have the short word, right? TB. When you write TB, they will know it is stand for tuberculosis. Example here, the children then succumb to disease like tuberculosis and pneumonia. Okay, another word is dengue, a debilitating viral disease of the tropic transmitted by mosquito and causing sudden fever and acute pain in the joint. We can say just like the fever, right, but related to the joint. So what does it mean, man? Yeah, right here. Okay, the same. And some example here, also you have to look into disease like malaria, dengue fever, yellow fever, and typhoid. Okay, another word is dysentery, infection of the intestine resulting in severe diarrhea with the presence of blood and mucus in the feces. Can say severe diarrhea. It's just diarrhea, but it's very severe. In Khmer, what does it mean? Yeah, remove, right? Very severe diarrhea. Look at that, but it's severe, right? Example here, there are no pus cells in the stool, thereby ruling out bacterial diarrhea like Shigella dysentery. Okay, another word is epidemiology, the branch of medicine which deals with the incident, distribution, and possible control of disease and other factors related to health. We can say disease that spread, right? Just like COVID, right? The same, right? That spread in the past, just like the disease that spread very fast. It's like now we can say a lot of disease, right? Okay, so what is it in Khmer? Yeah, right? Okay, and example here we have confirmed their research on cancer and cardiovascular disease dominate populist epidemiology. Okay, another word is typhoid. Right, we can pronounce it typhoid here. This word. Okay, and it's an infectious bacterial fever with an eruption of red spot on the chest and abdomen and severe intestinal irritation. We can say typhoid fever, right? Very fever, severe fever, the same, similar to the dengue, right? So what is it mean, Khmer? What? Yeah, con bồ viên rồi con cái tai rồi, same. Example here, check for yellow fever, typhoid, hepatitis, tetanus are recommended. Okay, another word is curative, able to cure disease. We can say healing, remedical or antidote. Just like you heal somebody by using herb. So what does it mean, right? Yeah, especially in Cambodia, right? We use herb. So herb is not dangerous, it's not hazardous to your health because it is the nature, right? It comes from the tree or some nature, right? It's not like the pill. So the pill they just get it, just make it chemistry, right? So it's a bit hazardous to your health, just like you have a fever, right? So you get the paracetamol, right? But when you get it a lot, it will be related to your lung, right? You can say hepatitis, right? You will have. That's why for the modern medicine, it's not good for your health. Another word is infant, a very young child or baby, right? So you can say the baby just born, right? So you can say infant. So what is it mean, right? Here to do here. And example here, several delivery devices are available for infant and young children. The word is prenatal, before birth, during or relating to pregnancy. That means the child right before birth in the mother, right? You can say prenatal. So what does it mean, right? What? Yeah, right? Just not to become a baby yet, just prenatal. Example here, the screening test study was prenatal serum screening for Down syndrome. Okay, now word is inconsistent, the last one. Not saying the same throughout. We can say changeable, irregular, unstable. Just like the word they just complete, they said your life is inconsistent, right? But your death is consistent. So what does it mean inconsistent here? What? Mình chỉ chừng bạn rồi còn mình tiên toạt rồi thì để cho chỉ vật dương mình tiên toạt tại sao tiên toạt rồi your life is inconsistent but your life is consistent, your death is consistent, right? Okay, so between this go on our book, we can just I said a major health problem and maternal and child health care. Okay, so the first one we start with a major health problem. Open your book, you can see a bit, I just quote it in some point. The most important health problem are, okay, we have more health problem right in Cambodia at that time. Malnutrition, CRD, right, don't have enough protein or food, malaria, tuberculosis, and diarrhea disease, right? So these are the four that we met. And agency working in Cambodia identify major problem and they are focusing on. So they're focusing on diarrhea disease, we met a lot. Acute respiration infection for the baby, malaria and dengue fever, and childhood illness. This is because of. And Department of Epidemiology in Phnom Penh stated their prevent is better than treatment. Okay, so for the disease that in fact, right, epidemiology studied already. So Department of that they said prevention is better than cureness, right? Treatment. So you prevent before it happens. So it happens, it's hard for you, right, to control. And the healthcare system is based on curative medicine with minimum emphasis on primary healthcare. So at that time we focus, I mean, a curative medicine, just like the herb, right? That we get it from the nature, just like the tree, the leaf of the tree. Okay, the Department of Epidemiology had been working on UNICEF on healthcare and distribute prevention health education material via. So at that time we connected with the UNICEF, right? And we broadcast to advertise on radio, television, newspaper, poster, seminar with flip chart and audio visual display. So at that time we don't have the internet, right? That's why we advertise or give information is low yet. Okay, so maternal and child health care for the mother and the children. NGO health personnel report the major cause of children that are, right? So children that because of diarrhea at that time, and dengue Garlic fever, malaria, respiratory infection, and malnutrition. Didn't have enough food to eat. And PMI, the Department of Maternal and Infant Protection with NGO and UNICEF, has tried to improve prenatal and infant and children health through education and direct care. So at that time, they give education and direct care go through their place, right? To help for their infant and prenatal and healthcare with the mother and children. Okay, in 1985, you see, at that time, maybe some of you not born yet, right? 1985. A system was designed for children under age of 5. Okay, and center was established for rehydration, immunization, nutrition, and education. Okay, the last one is in 1989. At the time, there were 10 centers in Phnom Penh and 9 in province. So in 24 province at the time, only 24, right? But now they add more, 25. So only 10 in Phnom Penh, right? And 9 in province. So it's a very few of a medical center. And according to Ministry of Health, children are vaccinated against tuberculosis, diphtheria, polio, measles, and tetanus, and tuberculosis. So we have a vaccine, right? But now we still have vaccine also, just like again COVID-19, right? And most of people living in Cambodia is vaccinated already. Okay, so that's all for our today, and we will discover more in our take, right? Okay, thank you.